Hello fellows and mentors, if you're watching this, my name is Gareth Durrant. I work with DSIL Global. I am a public health leader like you, and I work at the intersection of design and public health. Today I want to talk about designing public health leadership programs and what that means in our current context, and also to give you a bit of a sense of the journey that we're going on together. So I was unprepared for every leadership position I've ever had. I graduated my MPH kind of with this arrogance that I had all the competencies I needed, technical or otherwise, to take on director roles or management roles in the area. And in each of them, there was a learning curve and certainly a lot of failures. And I think it's fair to say that we were also unprepared as a community of public health leadership practitioners for the pandemic as well. So where does that leave us? Well, we've got to design something new that meets the needs of the current time. So what does that look like? Designing in context is really important. So what are the building blocks that we're working with at the moment? I think number one, we need to understand the demands of the discipline. So public health leadership is absolutely no joke. There are immense tensions and pressures. We have to be humble and engage with community, communicate with integrity, build trust. We also have to be technically proficient and academically rigorous. We have to be resilient for the long haul and know that our advocacy outcomes won't be seen for 20 years, but we have to be immediate and responsive when there's emerging pandemics or even just scientific knowledge. So that is a tall order. So we need to acknowledge that, and that we are working within complex, dynamic systems, and we need to take a systems approach to the leadership that is expected of us as public health leaders. The other thing that's really exciting about public health leadership, I think now, is that public health leaders come to the work having invested in the inner work that they need to do. So when we look at public health leadership programs and other leadership programs, we talk about a self-to-systems model. So we look through who you are as a person, what you bring to the table, power dynamics, biases, all of that. Then how you interact with others, teams, organizations, and the systems, and what systems change you want to make at the end. People who see public health as a calling have already orientated themselves to causes and community and thought through what kind of change they want to make in the world. So it feels like we have a head start simply by you being you. One of the other things is, I guess, the democratization of public health leadership. So we have spent a lot of time in silos, we have spent a lot of time in, our little expert bubbles, but public health leadership is expected and needed and seen in our local grocery store as part of parent-teachers associations at schools. It's about our family life, deciding how you want to navigate Thanksgiving this year. All of those things are how we show and experience public health leadership, and everyone on this planet has, for the last 2 years, had direct and visceral experiences of good or bad public health. It means that we're inviting in a ton more people to a far more diverse conversation than we've ever had, and that is a good thing for us as public health leaders. The other thing, I guess the final thing that are the building blocks of this program design is that we know what works. So public health leadership, this particular space, we have the tools that we need. So we know in public health leadership that 360 feedback loops are really important. We know that mentoring and coaching are fundamental to individual growth within broader cohorts of people. We know following peers along with a journey is really important. Seeing yourself in others, having group challenges that are meaningful. They come from the workplace you are currently working. They're not case studies, they're not hypotheticals. They are actual issues that are alive in the system that you're working. Stretch zones or activities that allow you to come face to face with conflict or learning edges. These are the things that are needed, and these are the things that work in developing you into the leader that you need to be for whatever we've got coming next. The other thing that's really exciting is that we're starting to get really clear on the language that we're using and the other tools that might be really suitable for a public health landscape. Things like equity-based design, things like systems innovation and leadership or systems thinking, and also emergent strategy. So what does it look like when you see and reflect a system and move in that way and move away from top-down linear binaries and things like that? I know that that's a lot of information all at once, and I know this comes at a time where orientation is happening. Some people are moving to Atlanta. There's a lot going on, and don't forget we're in a pandemic as well. We will continue to communicate the design, the evaluation, as well as the architecture of this program with you, but know that you are a co-creator in this space. So as you are going through your inductions and orientations, I really want you to think about what kind of leader you want to become in this space and how you would design a program that reflects equity and meets the needs of public health leadership for today and beyond. Thanks very much for watching. Bye.